Hey guys, talking about Core 5. What is Core 5? Core 5 is your final test. Core 5 is going to be distributed and pointed on the schedule according to our doctors and their team. So you've completed the curriculum of Core 1 through 4 here at SI, and now you want to pass and go to that next level and get stamp of approval by SI Institute. You also probably gone back home and realized that your team's not trained on photogrammetry. And you're going, oh my God, I love this stuff. You're addicted now, and you want to get a full mouth arena, whether you're doing simple cases, advanced cases, and all that above. And if you've gone through my program, you know what I'm talking about while you're watching me talk right now. But when you got back home, you realize your team's not trained. What scanner do I get? How do I micromap? How do I tissue scan? What printer do I do? How do I train my assistants to actually do the print? How do I do XCAD design? This is where it all comes together. So after Core 4, if you're a doctor that has your own practice, Core 5, you're going to come back solo. You're also going to be able to bring back your team. Your team at the time of surgery will be doing it with you. Your team will learn how to do XCAD photogrammetry, right? You're going to be able to learn the trios and do the scanning. What's the next step? How to do fiduciary markers, how to micromap, how to get it all the way to the 3D print. Your own team here is going to actually make your patient, because each doctor is going to have their own patient, your team is actually going to be able to print, stain, and glaze, and put this in your own patient's mouth during your Core 5. Core 5, you're also going to have to take some written exams and have demonstration random to show that you're competent in all areas that you've learned throughout the SI workflow. Those doctors that do not have their own practice, you can still come to Core 5. You'll have your own private Core 5 or comboed with. You'll still have the exams, all that stuff, and when you eventually do buy your own practice, you can actually bring your own team back, a part of that at a later date.